This next section is looking at ice and the drug itself and its effects, looking at the forms of the drug, the way it's used, its effects, its harms, and its brain effects. Amphetamines and other stimulants are listed here, including the amphetamine group of drugs, such as speed, govy, gas, whiz. This is the older style. It's about 10% pure and is a mixture of amphetamines. There was a form which was an alkaline form, which was about 50% pure, called base, and it could be vaporized. This was an older form of vaporizable stimulant. And then we have ice, which is also called shard, crystal, shabu, glass, about 80 to 90% pure. Also in this group includes diverted medicinal stimulants such as dexamphetamines or even Ritalin. Other stimulants besides amphetamines include the cocaine, which is called coke or crack, rock, Charlie, etc. And there are some designer drugs or novel psychoactive drugs that also are stimulatory, and also ecstasy to some extent, or the substitute drug in ecstasy pills. Ice can be used in glass pipes or glass tubes, the older style light bulbs, or just inhaling off a piece of aluminium foil. It also can be snorted, and can also produce problems with the nose in terms of similar to cocaine, an erosion of the cartilage between the two nostrils. It also can be injected in various places. Unfortunately, if it's injected into an artery, it causes spasm of the artery, and you can see an example of gangrene of the fingers caused by injecting into the wrong place. It can also be wrapped in a piece of paper and swallowed, or inserted rectally. One can conceptualize the effects of methamphetamine on the body and the mind as just having everything wound right up. In the body, it causes sweatiness, shaking. A person may look pale or flushed. It increases a person's strength and energy output, produces a high pulse and blood pressure. Pupils tend to be large, and the person may be wide-eyed, and there may be an increase in picking behaviour of the skin. In the mental signs, alertness is increased. A person's mood may be high, overconfident or irritable. Thoughts are high flow, may be illogical or jumbled. There may be actual hallucinations and delusions. A person's behaviour may be accelerated, lots of automated tasks such as cleaning or gathering, hoarding in a disorganised fashion. The person also is super alert and stays awake, and often besides not sleeping, they also don't feel an appetite, so there may be weight loss. This is an ad from the US just showing the effects of methamphetamine on a young man. They say he's tweaking, his heart's racing, he's grinding his teeth, talking really fast, not making much sense. You can see he's sweating. He thinks he's sexy and popular, he's overconfident. Sexual feelings are increased, and he's increased his risk of getting HIV. So it increases risk-taking behaviour, and sexual behaviour increases dangerous injecting behaviour as well. This just shows the effect on pupils. Unlike opioids, which tend to produce pinpoint pupils or small pupils, amphetamines produce large pupils. Large pupils is a sign of adrenaline or pain, and that can be produced naturally, but is also an effect of methamphetamine. People often have a breakout of acne on their face, and also they may pick their skin. There may be a degree of delusional belief that there are parasites or some sort of invasion of their body. This occurs in some people and can be extremely hard to convince a person otherwise. The harmful effects of methamphetamine are numerous. Looking at mental health, it causes anxiety, depression, suicidality, often sudden mood swings, psychosis, addiction, impairment of people's thinking or cognitive impairment, and trauma. Physical health, injecting related effects such as infections, causing abscesses, hepatitis, irritation of the vein wall, and causing clots which can travel to the lung, gangrene if people inject it into the wrong place. The drug effect on the heart can cause heart to enlarge, can cause excess pressure on the blood vessels, leading to stroke or heart attack, and then seizures caused by overexcitation of the brain. Behaviours are altered, obviously, and increased violent and aggressive behaviours, increased criminal involvement, both to procure and also due to the increased risk-taking behaviour, and higher risk sexual activity and injecting behaviour. It has adverse effects on people's relationships, on their vocation and their financial well-being. It can also cause sudden death due to overdose, accidents caused by reckless driving or behaviour, and suicide, sometimes caused by sudden mood changes or perceptual changes. I'm just going to play this video now about methamphetamine's effect on the brain at the level of the nerve cell and how that affects dopamine receptors in the nerve.
Our brains are finely tuned machines. Inside, cells called neurons are constantly communicating to shape how we think, feel, and act. Let's eavesdrop on their conversation. These are the ends of two neurons. The one on the right sends a message, and the one on the left receives it. At first, they look connected, but they are actually separated by a tiny space called a synapse, where messages are relayed. What we'll see next is how we normally experience pleasure. The sending neuron contains dopamine, the brain's pleasure chemical. When something good happens to us, this feel-good chemical is released into the synapse, where it connects with receptors. There, dopamine activates the receiving neuron, which in turn conveys the message onto the next neuron, creating a chain reaction that produces pleasure. After the message is sent, dopamine is recycled by transporters to be reused. This conversation repeating itself again and again gives us the feeling of pleasure. How does meth change our brain? When we use meth, it enters the bloodstream and travels to the reward center of the brain, where it invades the sending neuron. Meth causes dopamine to unnaturally leak into the neuron, then spill into the synapse. Making matters worse, meth blocks the transporters, which recycle dopamine back into the sending neuron. This keeps levels abnormally high, overstimulating our brains. We feel a powerful wave of pleasure. The rush can last 8 to 12 hours from just one dose. Meth causes dopamine to flood our receptors. When we stay up, taking more and more meth, we exhaust our dopamine supply. When the regular dose doesn't give us the same rush, we take more. But now when meth reaches the brain, it finds a lot less dopamine. Plus, meth has destroyed transporters. And on the receiving neuron, all that overstimulation we loved has caused receptors to withdraw. So it's just harder to get high. No matter how much meth we use, we can never recapture that first rush.
The next slide will look at scans of the brain, looking at dopamine transporters as shown in that video. This slide shows a special scan of the brain which picks up dopamine transporters in the brain, in the animal part of the brain or the limbic system. It shows a reduction in the number of dopamine transporters. As you saw in the last slide, these tend to be reduced in people who are using methamphetamine. And you may remember from the first talk, dopamine is involved in alerting or stimulating the frontal lobe or the smart brain. So when these dopamine nerves are reduced in function, it affects the ability to think and to perform actions. This actually shows a study where the fewer the number of these dopamine transporters that are expressed, the longer it takes to do a physical or a motor task or a memory task. Therefore, even though somebody may appear perfectly normal on the outside, there may be significant effects on the person's brain function from amphetamine use. So how long does it take for this to recover, or can it recover? And the answer is there is obviously some recovery. This is a copy of a scan showing that after 24 months, the dopamine transporters have returned to normal levels, and this was associated with an improvement in the person's ability to perform a motor task or a physical task. It shows that at a month there was still a reduction in the dopamine activity. It's hard to say how long it takes, but the general consensus is that things start improving after about 3 months, and it may take up to 12 months for a person to become pretty much back to functional state. That being said, there are a lot of effects on dopamine's nerves that may not recover, and sometimes a drug-induced psychosis or delusional thought pattern may persist. So it's a highly variable thing, but we just say that in the first 12 months, the person needs a lot of support, and even though they may look like they're perfectly back to normal on the outside, when you actually get them to do something, they may not have the focus and concentration that they had prior to using methamphetamine. One can think of the phases of stimulant withdrawal in 3 parts. The first is the crash phase, which is simply the restoring of the dopamine levels inside the nerve terminal. And within hours of a person not using amphetamines, they will start to experience this level of exhaustion. They may actually be agitated before they finally go to sleep. They may require something to settle them down to bring sleep on. And they often seek some sort of sedative in order to bring this sleep on at this point. And this period of exhaustion lasts a few days and sometimes up to 2 weeks. Then there's the intermediate phase, and this is different to the restoring of the dopamine levels in the nerve. This is actually recovery of the nerve, the dopamine nerve itself. And as we mentioned in the previous slide, it can take 3 to 12 months for those dopamine transporters and the nerves themselves to recover to a degree. And during this phase, people experience a low level of enjoyment and motivation or energy for something that they may have enjoyed previously. And there's an intense craving for the drug as this low dopamine state is quite uncomfortable. Then there's the unlearning phase, which is to do with associations. As we saw in the first talk, there's a lot of associations, such as the time of the pay cycle, people, locations where people can procure drugs, and these sort of associations, things that trigger cravings, need to be unlearned. And this is an ongoing process that takes months to years. We'll pause here again, and in the next section we're looking at treatment for ice addiction.